sticking with the coronavirus, but moving on to the U.S. Department of Veterans Affairs, which was the first federal agency to require employees to get COVID vaccines. That was just last month. Well, this morning, the VA is extending that requirement to cover a wider range of workers and volunteers at VA health facilities. Only on CBS This Morning, Veterans Affairs Secretary Dennis McDonough joins us now from Washington. Mr. Secretary, good morning to you. What can you tell us about the impact that your original mandate had, and what more can you tell us about this new one?
Yeah, thanks so much for having me, Tony. It's good to be with you on such an important topic. You know, a couple weeks ago, we mandated about 115,000 people to get the vaccine. These are healthcare professionals who are most regularly in touch with veterans. That's what this is all about, keeping our veterans safe. And what we've noticed is that there's an uptick, about a doubling of the rate of vaccination among those 35,000 healthcare professionals of that first wave getting vaccinated. So that's progressing well. Based on that, we've decided that we'll start tomorrow expanding the vaccination requirement to 245,000 additional employees. About 110,000 of them, we believe, still need the vaccination. We're doing this for a simple reason, Tony. This is the best way to protect our veteran patients in the VA system. They've given so much to this country. They ought to have the confidence that when they come into a VA hospital, they're going to be safe.
Yeah, and preparedness is part of the VA mission. Based on your experience, Mr. Secretary, I'm curious, would you recommend a mandate be expanded not only to the VA healthcare network, but to all federal agencies?
Boy, I got my hands full right as it is here with this big federal agency here, the second biggest one in the country. We have about 405,000 employees. We're working through to make sure that each of them is safe. Each of them has the vaccinations they need, and most importantly, our veteran patients are safe. That's what this is all about. So I'm focused right here on us. I'm sure others are making these kinds of decisions and thinking this through. Our experience is that this is complicated, but it's very manageable. It's leading to an increase in vaccinations, and we think that's going to improve outcomes for our veterans.
But the fact you guys decided to come out and talk about this positive experience, the increase in vaccinations, some might read that as a suggestion that you're laying the groundwork for a broader mandate.
Well, some may, but I'm not big in kind of signaling. I'm big into communicating very clearly. And my communication here is very clearly this. The most important thing each of us can do, whether you work at the VA or work somewhere else, to protect our veterans, these heroes who have given so much to our country, the most important thing you can do is get yourself vaccinated. That will protect our veterans who have complicated healthcare situations, who have more comorbidities because of the great sacrifices they've made on behalf of this country. So if you want to protect veterans, go get vaccinated. That's the very simple message I want to send.
Mr. Secretary, I was surprised and also disappointed to learn in preparing for this segment that the typical VA hospital is almost 50 years older than the typical private hospital in this country, and yet funding to modernize those hospitals was left out of the recent infrastructure bill. How will that impact your ability to provide care?
Look, first of all, the most important thing we have in these facilities are the people, and they're an unbelievable team. We're communicating with them all day yesterday, all day today about this new vaccine requirement, and that's going to continue to be the strength of VA, our people. Secondly, it was not included, the $18 billion that the president asked for was not included in the bipartisan package passed by the Senate the other night, but it is included in the broader reconciliation package that's now going over to the House for consideration. We're really hopeful that they'd make that investment because, as you say, Tony, of our facilities, the average age of those facilities is more than 50 years old.
Yeah.
In the private sector, the average age is about 10 years old. That's just not sustainable.
Mr. Secretary, before you go, just one more question on a story that we've been covering closely here at CBS This Morning. Our Catherine Herridge has followed the experience of veterans who served at a base in Uzbekistan known as K2. It's since been closed, but there were toxic substances there. They were exposed to it, and their doctors believe that various cancers have followed. Yet the VA has denied services, and those looking to appeal have been waiting 2 years or more in some cases. What's being done to help those veterans?
Yeah, thanks so much for that, Tony. We announced early last week, a week ago Monday, that veterans who served in Uzbekistan as well as Afghanistan and Iraq over the course of these last several decades can now apply for presumptive coverage. That means that we will presume that the conditions they're experiencing were associated with their military service. They can now apply for getting things like rhinitis, sinusitis, and asthma covered and cared for at the VA. That's just the start of our effort to make sure that we're protecting the veterans, getting them the service and the care that they've earned and that they deserve because of what they've done for us. Uzbekistan and Catherine's reporting is one example of that, but there's many, many other situations that our veterans have been in that we believe have created problems for them. We're going to make sure that we make it right for our veterans. We started that last week. That's just the start. So I urge veterans who find themselves in that situation, please file your claim with VA. Please come forward. We're going to make every effort to make sure that we're not only getting you the care that you have earned and that you deserve and that you need, but that we're also going to make sure that you get the benefits that you've earned.
Secretary McDonough, presumptive care, that is a big step. We appreciate you coming on this morning to talk about a variety of important issues, and we'll have you back soon.